Good evening. Uganda's health sector has suffered a series of setbacks, ranging from poor remuneration to the medical workers, poor infrastructure, brain drain, and sometimes total neglect. It's not uncommon for high-ranking government officials to seek medical services in Nairobi, India, or South Africa. If the powers that be cannot be treated in Ugandan public hospitals, how will they understand the challenges of the health worker and the tools they need to execute their duties? Now, the National Referral Hospital is in the eye of the storm for contracting private pharmacies to operate in a public institution. Well, to discuss this and more, we have the Honorable Dan Kimosho and Dr. Ekwaro Obuku. Gentlemen, thank you so much for having honored our invitation, and a warm welcome to both of you. The eyes of Uganda are on you tonight, and thank you for having been able to make it to come here.
Thank you very much, Patrick, and thank you, our viewers. We hope to have a very productive discussion.
Thank you, Dr. Obuku.
Thank you, Mr. Kamara, for inviting me here, and good evening, viewers. I'm happy to be back to the sport.
Let me begin with you, Dr. Obuku, because you're a medical doctor, but also at one point you're the chairman of the Uganda Medical Doctors Association, or something like that, if I'm not bringing it very well. Where do you stand on the fact that we have private companies providing pharmaceutical services, or private organization, pharmaceutical services in a public hospital like National Referral Hospital, Mulago?
Yeah, thank you very much. I was president, Uganda Medical Association.
President.
Doctors. And I retired in 2019. I handed over power peacefully.
Okay.
And two presidents have come, Dr. Idro, Professor Idro, if you like.
I know you're passing your message. I know you're passing your message.
Yes.
It's okay.
And then now another one
peaceful handover
has also come, and is an ardent member of his party, NRM, Dr. Ledo. So we are really in the books.
So what was your party?
Yeah. I was a political pedestrian, just observing.
Well,
anyway, going by the point.
Going by the colors of the garment. Okay.
Okay. So I think I wanted to give this perspective. So globally, the global economy has grown over the years. How long a human being lives today is much better. The same as Uganda. Uganda started in 1986, according to Kimosho's political Bible. Life expectancy was 45 years, or around about that. Now it is above 60. And there have been success stories, immunization and so on.
Thanks to NRM.
Well, that's why I said Kimosho's Bible. Burundi, Rwanda, the East African community have also grown in that respect. The economies have improved. So in 2015, the global leaders realized that despite this improvement, there was inequity. Meaning, there were people who were being left behind. Poverty, education, access to health, food security, etc. And they coined something called leave no one behind. Meaning that even if the world is richer, we still have poor people. Data had shown in those European countries that improvement in the economy, for example, Norway, or reduction in poverty, reduced the burden of certain diseases like TB. And this is the aim of all these economic interventions. Let's put this perspective into Mulago. The budget of Mulago is chronically underfunded, isn't it? Government has done its best to fund the healthcare system in Uganda using a tax-based system. You know, pay as you earn, and all this money, then they divide it and say 6 to 9% goes to health, although we expect that it reaches the so-called, the magic 15% of Abuja declaration. Now, there are innovative ways. Healthcare managers, like the director of Mulago, must find ways of bridging that gap. One of the biggest challenges in public health facilities is the chronic shortage of drugs. Because it's a war. You know, medical technologies, diagnostics, supplies. You may have a machine, but there are no test kits. You may have a pharmacy, but the required drugs, NMS budget does not permit them to be sufficient for the population. And there are very many mechanisms globally. Healthcare financing is a problem. How we finance healthcare in the US and so on. So globally, there are mechanisms which have been shown to work. One of them is a national health insurance scheme, okay, to improve financing over and beyond what government puts in. The other one is what we call public-private partnership models, which brings forth what is happening in Mulago. You can get a private contractor to supply laboratory services, the whole of Uganda, as Ministry of Health. So all of the money you get, which is under the budget line of lab services, you give it to, say, Lancet Laboratories, and you just tell them these are the minimum expectations. You must do a malaria test at 1,000. Because of volumes, then you negotiate the price. I believe what was happening in Mulago and Mbarara and elsewhere were innovative ways of bridging the gap of supply of drugs. However,
so that was a long preamble yes, it's okay.
No. However, there are certain issues around the perception of corruption. One of the forms of corruption is serious conflict of interest. For instance, if you have a private pharmacy there, and at the same time you are running a public pharmacy, the interest of who supplies what becomes a problem. If I'm in a position of power, I can ensure the public pharmacy has nothing and make sure the private pharmacy is running and I get dividends from it. So those are some of the things which need to be sorted out and clarified so that...
As president of the Medical Doctors Association, right, is that something that you discovered?
Pardon?
Did you discover that perhaps there was conflict of interest in such situations?
Well, if you look at the report which has been submitted, I think one of the issues they were investigating, for instance, was a lag in the payment of rent.
I have since seen some form of evidence from one of the pharmacies indicating that they've been paying their ground rent consistently.
So maybe you can see now, maybe it was not being registered in the public system.
All right, let me come to the Honorable Dan Kimosho. Where do you stand on this issue of, well, he's given us a very good preamble that there should be sometimes a public-private partnership and sometimes you can procure a private company to give some of these services. But there's always a line of conflict that can exist, you know, a conflict of interest. Real, we are human beings in a country that has serious integrity deficits. If you create something like that, it can easily be abused. And perhaps this has been the case.
Yeah, thank you, Kamara, once again, and my colleague. You see, the issue of health sector in Uganda, we need to look at it holistically. The issues we are discussing are part of a bigger systemic challenge that has been haunting the health sector. Yes, we can decide to talk about the private pharmacies. You see, the private pharmacies in any government hospital is like the old story they used to tell us when we were still kids. That blind man, they put an elephant in the room, put blind men. One who touched the tail said the elephant is as small as a stick. The one who touched the ear also described what they touched. When you ask the managers of those facilities, they will describe for you the scenarios that force them to do what they're doing. You and I on the outside will start to examine the conflict of interest, the integrity. Now, why is it hard for government to harmonize the work method? That in our work method, whether there is medicine or not, we do not entertain pharmacies in a government facility. You see, it doesn't mean that for you to accept standards that they must be plenty. No. And as long as you accept that there are standards that you work with what is available. Now, I think sometimes what brings us challenges is that there is always a room to circumvent a few things and things happen. Now, at a level of a manager, he gets constrained, like Dr. Barrow explained, and he will devise means. At the level of a supervisor, he faults the manager. At the level of a patient, he will accuse the person in the dispensary that they have refused even to give me medicine when they have it, and they are sending me to the private pharmacy because they want to create sales for the private pharmacy and thereafter share at the end of the day. You see the ambiguities.
You're not
Now,
just a member of parliament, Honorable Kimosho. You're also somebody who understands the sector well. At one point, you were speaking for the national medical stores. You were an insider at one point.
Yes.
So
Even
what is the
Mulago.
actual,
He
even in Mulago.
yes,
So what was
Mulago.
the actual point? When people say, you know, conflict of interest, is this something that you witnessed?
Not necessarily, but I got an opportunity to move around this country in different health centers. Leave alone, before even the issue of private pharmacies came in, we had issues, and maybe Kamara could have either experienced or heard about this. We had issues where a patient goes to a government health center, and even when the medicine is available, they refer them to the next pharmacy outside the facility. Because even now, as we talk, many managers of government facilities have pharmacies.
So what you're telling us, this public-private partnership has been abused?
I think it can work if it is well streamlined.
Well, but in this case,
And for
it has
me-
been abused, and you actually have some form of evidence because you have seen it happen.
No. The form of evidence I have, that I have heard and seen, is that even when they are, these pharmacies, even when they are not in the facility inside, a sharp doctor will put a pharmacy in the neighborhood. And naturally, Uganda, doctor knows this better. We have our standard clinical guidelines. It will tell you, if you diagnose Patrick with malaria, what is the first line of treatment. There are instances where we could find that even the first line of treatment is available in the facility, but because Kamara, the doctor, has a clinic or a pharmacy in the neighborhood, he would prefer for a brand name of a product and will certainly refer that patient outside the dispensary to go out and buy from the neighboring. So it is a whole systemic challenge. And I can tell you, Kamara, if we must, and you see, what we are seeing here, I was sharing with Dr. Obuku. This is not the first time it's happening. When I was in Mulago, late Dr. Dumba was arrested under exact circumstances. It is my first time to see an ED and a doctor being grabbed by his belt. His toys were the only ones stepping on the floor. Now, what am I saying? I am saying that we need to take deliberate efforts as a country. Remove all the lacunas that give people leeway to either enjoy conflict of interest, as anyone would want to call it, or enjoy the ambiguities of the system and worsen the already bad situation of the health sector.
Okay, Dr. Obuku, couldn't the managers of the affairs of the Ministry of Health, for example, and Mulago, couldn't they have envisaged that something like this could happen, the conflict of interest, and avoid having this PPP take place in our public hospitals because of how Uganda is?
Yeah,
I mean, because this was not somebody's idea. It was something that was actually advertised, and they called for services, and people responded to the call, and the highest bidder won the day, and then they put a pharmacy in the public hospital.
Yeah, and
here we are.
PPP models have worked well on roads. Government rarely works on roads. You go out there, contract, a joint fund, private contractors from Uganda or abroad develop the road, maintain it, and so on. But I wanted to give us perspective. You know, sometimes we are in too deep, discussing like technocrats, going to give solutions. But if you pull back, you will see there's a Wall Street report now showing the bottom 30 countries in the world. And they are published about 600 million, 700 million. When I studied that list, Uganda was one of them. You know, suggesting that we have to work double hard to make sure the tax dollars we borrow, give us the return on investment. The taxes we pay as Ugandans, we must stretch that ceiling to give us a return on investment. That's very important. We must try hard to fight corruption. If you look at the National Integrity Report by the IGG of 2019, the perception of corruption is very high on things like bribery, embezzlement, and nepotism, over 80%. But the perception on conflict of interest is very low. So what we are discussing is the tail end of corruption, conflict of interest. There are bigger things. For instance, if you go to Mulago, I know that for sure, looking at the reports, they received a loan of $50 million, isn't it, to renovate. It's not finished. As president of the Uganda Medical Association, as I was ending my term, we had to make a noise to say, please don't give Lubowa money before Mulago gets its last bits. At that time, the management was saying they needed 6 billion, it grew up to 35, they got it. I was very shocked about 3 months ago to visit Mulago and see a whole area not renovated. I think 3rd floor and some whole buildings. I reached 6th floor, I was shocked when I found my uncle, and after some conversation he told me they're fetching water in jerrycans for the past 1 week. I was a student between 1998 and 2003. I had sick relatives there. I would wash my hands when I go to visit. The water was flowing. 2006, my father was admitted there with cancer. I could wash my hands on private. 2021, after $50 million investment, fetching water. So those are the bigger issues. Remember, Mulago was built, the history of Mulago is that it was built on Ugandan's money, not tax. Money of farmers who are cultivating cash crops. It was saved and it built Mulago. It was not a donation. So after all this struggle of independence and being, economically right, how is it that we have reached that level? For me, that is the bigger question.
It's because, as a member of parliament, you are aware that we're supposed to put about 15% of our budget, as per our Abuja declaration, into the health sector. But I think we have been struggling to around 8 or 9%. We, as a country, have not put special attention to the health sector like we should.
To the contrary, I would still disagree.
It's one of the reasons we have not funded
I agree with
the health sector like it's supposed to be.
Yes, but in other instances, we have failed to manage. Because, like he put it, at least the money for renovation was given. And the renovation did not happen as planned because the contractor, I here highlight some challenges that have nothing to do with what government had planned to do. I told you it's about systemic failures.
But you see, you are a member of parliament. You are part of government, the legislative arm of government, and you actually understand the health sector better. We expect people like you to actually have holy anger, if I may say, in parliament, and move the executive to do what it's supposed to do.
Yes, of course, you may have your holy anger or guilty anger. I don't know how you'd want to baptize it, but at times it may not work that way. We have had challenges recently with Lubowa. He stated it. And we put it to the House. We visited the site. We offered that company 1.3 trillion. It is the only hope. And you see, this is the challenge that I tell people. Cancers are on the rise. And even if you can afford, for how many relatives can you afford for? So, not that we don't put forward these things, Kamara. We do. And for me, at times, I tend to be very honest, and even when people get annoyed and disappointed. But we need to come out. For health, we need to come out and agree on the way forward as a country. Because Lubowa alone would have put for us about 2 Mulagos, well equipped. Lubowa alone, if assuming actually the money was put to right use, 1.3 would have one and another Mulago, in my view. Well equipped, well standardized, and no one would want or would need.
Dan, where is Lubowa Hospital?
Lubowa Hospital is in the foundation. We were there and there was no explanation. They told us COVID crippled them, but when it cripples you, where's the money? And you see, no one can explain. But and on that money, I think they already received around 80-something billion in Uganda shillings. And I think even government has already started repayment on the loan. So there are things. For
so
me, Mulago,
we went for a loan, got the money. The money is not being put to use, and the taxpayer is paying the interest on that loan.
Mulago, that one you. Mulago is where it is our national referral, but in terms of systemic challenge of the health sector, is a small component. You would also want to know, and these are the issues that we always put some of them forward, but we do not address them exhaustively. Most of the health centers, as he may confirm, are not actually under the Ministry of Health. They're under the Ministry of Local Government, especially from the health center for. And you may go to Ministry of Local Government and there is no officer designated for supervision of those health facilities unless they put them recent. The only person who is responsible is a DHO, who is like a king at the district. He speaks in medical terms. This, my brother, the doctors, you know, when they want to disorganize you, they speak in botanical names and you will not understand anything. And districts are stuck with non-functional facilities. So I think our focus as a country, yes, we may analyze Mulago tonight or tomorrow. Our efforts as a country should be concerted to how best we can have an average performing system of health care where the available medicines can serve a number and we see it. Because as we talk, even the little that is available disappears in thin air. You ask, whoever you ask, they are telling you the medicine is not available. Even the little that is available, no one explains it.
As if our Honorable Dan Kimosho is telling us our health system is suffering general brokenness, if I can use that word.
Yeah, but
how, I mean, you're a medical doctor. You're a president formerly of the Uganda Medical Doctors Association. Honestly, you understand these things like the back of your hand. What is the problem?
I wanted to focus on what is the solution. Because the problem stream is normally well formulated. Everybody knows the problem. Go down to the lady selling tomatoes, and she gives you her experience in accessing a public health facility. That is the problem, her experience. The barriers and so on. Okay? The solutions are there. Ministry of Health has very competent technical people. It is the politics. That is working in the politics. What are we talking about? The current problem, globally speaking, is how do we finance the health sector? A magic bullet globally is a partnership between the state and the citizen. Taxpayer, the taxpayer pays the bulk through government, then the balance citizens contribute. In any case, 40% of Ugandans are becoming poor because of spending on health. You talked about a colleague here on NTV who passed away from a cancer. You remember during that time, it is a car wash, isn't it? Yet, we can prevent that so-called catastrophic health expenditure, the one which makes you poor, you know, through prepayment schemes. And this is the spirit of the National Health Insurance Scheme. It has worked elsewhere, it can work in Uganda. What is the politics of the National Health Insurance Scheme? If you look at the manifesto of FDC, UPC, DP, and NRM, you discover they all talk about this. As a matter of fact, if you follow the past 4 elections, The NRM manifesto has promised a national health insurance scheme and a national ambulance system. I think the COVID helped us with the ambulance system because it was realized that we needed to jumpstart this. But the health insurance scheme has a very interesting history. Over 30 years, Professor Wori report gathers dust. In 2012, a bill comes, dies. In 2019, a bill comes, it is passed, goes to the president, and he says no. What are the three major reasons? The general public perceives a very high corruption index to pull resources together. You get what I mean? Who is going to manage the fund? Okay? Won't they eat it? So the perception of corruption taking place around that fund is very high. The Uganda Manufacturers Association, representing the private sector, have persuaded the president it will increase the cost of production. And you know, he's talking all of these economics to get Uganda out of poverty. The third reason is political. The president has stated, speaking of course on behalf of his party, that 68% of Ugandans do not participate, majority of Ugandans, about 70%, do not participate in the monetary economy. How will they contribute? I believe those of us who are proposing this insurance scheme have not persuaded the president very well for him to understand how it works. And anyway, countries like Thailand took 30 years to include something called the dialysis in their insurance coverage. So it takes time, but it must start. The president has had 35 years. Had he started then, maybe we would be at the Thailand level. Finally, if you look at the NDP 3, you know, Prosperity for All Ugandans, National Development Plan 3, and the indicator 7, I think, is health related, or target 7, and the Ministry of Health was hoping to realize what's called financial risk protection. Financial risk protection, meaning that you should not become poor because you are going to access health or medical care through an insurance scheme. Their target was 7% by, I think, the 2020-2021 annual health sector performance report. But they couldn't reach it. And the reason they gave there was the Gimoshos didn't work the politics well to ensure the president assents to the bill of the national health, establishing the national health insurance scheme. But when you look at some of the political issues, today as I was discussing with him, I asked him how was the day. He said, you know, we have been discussing Zake. Honorable Zake said this to the speaker. I said, Kimosho, even you were there? He said, yes. He said, what happens when you go to parliament there? Why can't we bring out these priorities of priorities? Not that the rules and procedures are not important. We must have governance structures so that parliament runs well.
I don't think they are.
But I thought the priorities of priorities will be the public policies, okay? The public goods and services, the social services, which I'm sure Honorable Kimosho and group were campaigning and saying, this health center, you know, I'm going to do this road, I'm going to do this primary school, I'm going to do this, your granaries, I'm going to do this, so that we have food security, we have health security, and we have security of education. This became obvious when COVID struck us.
I think that's very important, even though it's not a point of discussion, really. You spent the whole day discussing who abused who and abused what. How do we benefit? But look, I'm not going to digress into that, but probably food for thought.
Maybe the viewers also need to understand that Dr. Ekwaro Parliament. So did he want me to tell him what did not happen?
No, it's okay.
so I also will not digress. He asked me what was in Parliament.
And you told him?
I told him what was in Parliament.
Who was abusing who?
So he did not at least indicate to me that he wanted to be lied, to be given a different order paper. But that notwithstanding, you see, the issue even of apportioning blame, my brother is talking about politics. The Kimosho did not play politics, he did not explain this to the president. This gentleman has met the president many times than I have. In his strikes with the doctors, every morning you would see headlines, Ekwaro meets the president. Me, I don't meet the president apart from the caucus.
But you're in his party.
He has had the highest number of times to have the audience with the president to explain these opportunities in health sector that we can tap into. And then the Kimoshos, who come in also at a later point when you have made the president 1,000 times can add on. So the issue of apportioning blame here does not apply. And actually for me, Patrick, and dear viewers, I think we need to have a resolve as a country. The debate, we have debated issues of health care. I am telling you, we have debated, people have had, strikes have happened, workshops have really been conducted. I think it's high time that we embarked on the real work.
The reforms.
The reforms. You see, what disturbs me, you get the ministers, they are as disappointed as the doctors. Only for the ministers, because they have collective responsibility, they will not come and say out their disappointment. They equally have their frustrations. You talk to the PS, she's very enthusiastic, she wants to see things working, she touches this one, they don't touch. They touches, then politics at play, then the healthcare remains stagnant. You certainly want to believe that everyone is willing to work and reform this sector, but somehow no one reforms it. And you're wondering what is happening.
There is a party we voted into power called NRM.
Exactly.
And the buck stops with it.
Yes,
So,
but you see, the buck stops with it. But there are issues, if we had time, that would go in and digest. That they do not look at the party or the color or anything. He knows the safety of government medicine has been happening. That is a moral issue. The issue, even when they say services are for free, they are never for free. Whoever goes into a government facility, at least 80%, Patrick, you can do research about it, they part with some money, informal payment to someone to access this service. This is a moral issue. Yes, NRM, it's a political party, it's in government. Is it going to do brain surgery to people to remove immorality and lack of patriotism and sense of service? I think, like you're saying, the back stops.
It is 10-point program number 7 of elimination of corruption that came with President Museveni in 1986.
Which is okay.
36 years later,
which is okay,
it has only grown.
Which is okay.
I remember he tried even to do a walk against corruption. He was as frustrated as us. He also became almost like an activist. Maybe ideas are lacking on how.
I agree with you. But when you try something and it doesn't work, you have to devise or be more creative. I think we must be more creative and always talk to ourselves. Every opportunity that we get, talk to people really, to ourselves, because these are not foreigners. These are Ugandans that work in these facilities. That while we are pushing government that it has to do things in a certain way, but also what is available should be utilized in a way that government plans. Okay,
Honorable Dan Kimosho and Dr. Obuku, hold on to your points, gentlemen, because you're going to take a break. And on the spot, we'll be right back. Welcome back. You're watching On the Spot. My name is Patrick Amara. My guests tonight are Honorable Dan Kimosho and Dr. Ekwaro Obuku, and discussing the health sector reform. You know, there's one thing I've noticed. If people who are running the affairs of Uganda are not attending our public hospitals, how can they understand the challenges they're in?
But they are attending.
With all,
at least in COVID.
God forbid.
In COVID time, I can, and you know.
COVID was the equalizer.
You know.
because
10 ministers.
The airspace was closed and they had nowhere to go.
But you see, it's about perception. Maybe COVID also gave us an opportunity to know that our facilities can function. Over 10 ministers were in Mulago, admitted for 2-3 weeks, and discharged.
But because they didn't have an option done.
But I mean, the bottom line is that at least Mulago proved to everyone that it can treat them, and they are discharged, and they are back to work.
Yeah, we are happy they are back to work. But you see, what the norm has been is that, God forbid, if you fell sick today, probably you're going to be airlifted Nairobi or South Africa or India.
And then
in medical tourism, Uganda, I'm told we use about $150 million a year to treat our VIPs.
And that was the...
What is Nairobi doing right that Kampala can't do right?
Well, even those in Nairobi are going. I attended a big conference by the Indian hospital industry, medical, you know, and the Indian I met there said, but don't you have doctors in Uganda? So anyway, I just wanted to say that government, first of all, must be appreciated for increasing funding for drugs. If you look at the annual health sector performance report in the past 2-3 years, it has increased the funding for drugs substantially. I think since 2017, when I was president, there has been 100% increase in billions of shillings, over 100, 200 billion, by government. In terms of blood services, that increase was 100% in 2018-19 budget, and it has remained at that level, about from 9 billion to about 17 billion. It reached 21, then came down. The problem of blood transfusion has been sorted. This thing of lack of blood and so on, the logistics were sorted by doubling the financing. But when it comes to medicine, it is clearly not enough because of the dynamics he's talked about. You know, there is stealing here, procurement, fraud, and so on. Unlike blood, which has to be procured, unlike blood, which doesn't have to be procured abroad, it's there, and within 3 months, it has expired. Are you seeing the difference? So government has tried. Government should recognize that when it comes to health, the balance of payment is being done by out of pocket. The voters of Kimosho are paying. Kamara is paying either at Case Hospital, Nakasero. You get. So, His Excellency the President did a very good health sector reform in 2001. Lots of pressure from Dr. Besigye, promises of, you know, abolishing graduated tax, promises of abolishing user fees. The President was sharp. He took that policy and implemented it. He abolished user fees. User fees is that money you have to pay, 3,000 for a file, 500 for a test, and so on. But that was a barrier to the very poor. Access went up. People started utilizing the service. However, the government did not match the gap in the funding. What has happened? The payments are still there, but under the table, what Kimosho was talking about. So why not remove these payments from under the table and put them on top? That alone, transparency, will improve efficiency.
How do you put them on the...
You know, you create formal mechanisms of payment.
Formal way.
So that everybody says...
bring back what you abolished, the user fee.
Yes, it must come back and then formalized in the open. Because right now it's happening under the table.
Because by Honorable Kimosho's, estimation, maybe 80% of the people have gone there in a form way, are parting with money.
Facilitate. Then we can pull that risk so that the Kimoshos and the Kamaras who are corporates or in parliament, who are youth, relatively speaking, you know, in this country, if you're in your 50s, you're almost in youth because, anyway, you don't fall sick as often, but you still pay, isn't it? So that those who are sick, the elderly and so on, and the very young, benefit from it. See what I mean? So we pull these risks together, we pull the resources together, and ensure that formally the people can access what they need. So government must reorganize to meet this health financing gap. But I wanted to say something about corruption. We may focus on only those pharmacies, but there is certain corruption which has limited access of the voters to quality health care, universal health coverage. For example, the deployment of doctors.
Not voters, Ugandans.
Yeah, I want to say voters because...
that's the language you understand.
I think it's very important, my brother, that you categorize these, the citizens in the rightful way. These are citizens.
No, you know, politicians, as I told you, the problem stream is well defined. And this is an agenda setting. The solutions or the policy stream is also well defined. Ministry of Health has books, WHO books, and they have made their policies. But the politics is also working well. I wanted to encourage Kimosho. When I say Kimosho, I mean NRM party and so on. In 2000, the year 2000, the government that won the election in Thailand won it through the promise of improving the package in the National Health Insurance Scheme. So it's good politics, by the way, to promise these things and then deliver them. But the point I was coming to is, for instance, if you want to recruit a doctor now in the District Service Commission, do you know doctors pay money? I could not believe this when I moved around the country when I was president.
And do you know that, sorry for interruption, and do you know that even when they get the jobs, assuming it's true they pay money, that is actually true, some pay money, but they are never on station?
That is the other form of corruption, absenteeism.
Yeah.
And when, at least when I was president, we never condoned absenteeism. Okay? A doctor is hired in a health center for, comes once a month, fire that one. However, going deeper into the reasons, the guy says, I don't have a house nearby. You know, all those sorts of reasons. But as far as I'm concerned, I was very happy to see the annual health sector performance report. 80% of the health center force can perform cesarean section. Yeah. Although only 50% have blood services. So the Kimoshos need to reprioritize this money of politics to come to social services so that it's good politics of return on investment. Not the one of 5 million, let's go here, that kind of thing. Not the politicking, but the politics of service delivery. It's good politics. The NRM can continue to stay in power if they deliver to the people, because people just want services.
Dan, you know, we have had so many loans given to us. I remember there was a World Bank loan that was given to rehabilitate the major hospitals of Itojo, of Anaka, of Abimu, and Kiriandongo, and stuff like that. And I have seen, I saw maybe some improvement on the buildings, but I wonder, you can improve on the buildings if you don't have the right personnel, you're not giving them right remuneration, and the drugs are not there. We have not gotten any value in that loan, World Bank loan.
By the way, Patrick and viewers, first of all, there's something I want really to appreciate the team at the ministry. They have tried to make some reforms. Like you're saying, even when we got that loan, many facilities were renovated, and including, of course, that loan and the other money that is provided by government.
The capital development.
The capital development. When you look at Entebbe, when you look at Chiriandongo, when you look at
even Mubende,
yes. When you look at Mulago, Chirudu, Kawempe, there is some work that has been done. And that's why I appreciate the team at the ministry and the government. But after putting up the structures, I still insist there are things that we need to streamline. You see, Kamara, the challenge, yes, structures are good, but if there is no water, like for example in the health center, it is as bad as anything else, because at least one will come to treat malaria and they will go back with diarrhea and typhoid. But what I want to emphasize is that in the space of about 3-4 years, there are some serious milestones that we can talk about, even at the district level. I can tell you for the very first time, maybe in many years, or in the history of this country, most districts were provided with transport to the doctors and the DHOs for monitoring, for supervision, which was never the case. Of course, with COVID, it also came with its dynamics, and some or most of the facilities got the ambulances. Now, what we look up to is the sustainability. And there's been many, I mean, we have had several support from different partners in terms of building stores, medicine stores, and the rest and the rest. Several initiatives by Ministry of Health and the government. However, what is still outstanding, Patrick, is to set a system. You see, for me, the challenge is not that we are lacking medicine. No. I want us to have a real shortage of medicine. That when we don't have, we don't have. And we are able to quantify what we need. The challenge here, Patrick, is that when we are lacking medicine, we don't know how much we are lacking. Because part of it is for stealing, part of it is for expiring, because the systems are not clear. The logistic systems are not well defined and not well automated. And, you know, even to determine the gap is very, very difficult. So I think if the Ministry of Health can also now try as much to engineer the processes in the facilities. Up to the health center 3, what he was talking about, those doctors that ask for jobs at the district level, my brother, these guys are never there. They start moonlighting around Kampala health centers. They go to the district once or twice, and it is so complicated. I think it's out of the democracy, by the way, Kamara, even when we are laughing about NRM, it has given people a lot of liberties that even when they are doing wrong, they can have liberty to go to court, challenge, keep around, and they are given costs. You find them really even trying to attach district assets because they were terminated wrongly. But when in actual sense, they have not been working. So we need to re-engineer our systems.
That is corruption also.
Funding is a challenge, but we can only determine the funding gap when we utilize optimally what we have as a country, which is not exactly happening.
I understand, Dr. Obuku, some medical personnel, nurses and doctors, have gone for almost 6 months without pay, especially those who worked in the time of the pandemic. I know you're no longer president of Uganda Medical,
yes,
Medical Doctors Association, but is that true?
I'm not sure about that, but it's possible. It's possible because those were allowances probably, and allowances, I'm told, are paid as and when the money is available.
But they came to our committee on COVID, and I remember the minister came back and reported they had paid.
Oh, that's good news.
So
their medical workers was claiming they have gone 6 months without pay.
Well, that needs to be investigated. I'm sure the president of the Medical Association and Ali. But the point I wanted to bring, I wanted to re-emphasize is political will. In the National Integrity Report by the IGG 2019, when Ugandans were asked, what do you think can change the corruption situation? And the political will ranked very low, at less than 20%. I think the decision to start a supplementary health financing system, which has the spirit of national solidarity. You know, the NRM, one of the 4 NRM principles is... Let me finish.
Yeah, but one thing I just want to say that, you know, these politicians actually don't touch public resources. In most cases, it is the technical people are all handling
yes,
money.
what I'm saying is,
in most cases,
the political decision to change to give a supplementary financing mechanism, you know, to establish the law of a national health insurance, that's a political decision. Okay. The technocrats cannot do that. Then they can continue with oversight. But the perception of Ugandans is that there is no political will, for example, to fight corruption, and now, obviously, to institute a mechanism of alternative health finance. Why? Because Ugandans are paying anyway. So if you're interested in your voters, why not organize that fund? Look, in Western Uganda, we've done this research in Makerere University, in my research group, the Center for Systematic Reviews, College of Health Sciences. We discovered that there are actually burial clubs in Western Uganda. People organize money and say, you keep. When I die, my casket should be like this. Why not make them health clubs? We discovered that communities...
I found it in East and North. Why are you...
Okay. No, the research we found. This is research we found. We also found there were success stories in pooling resources by community.
For burial.
A very good one. No, for health even. For example, in Luero there were schemes, and there's a Community Health Insurance Association. There's the Kinkizi, is a very good example. And the WHO came and studied it, transported it to Rwanda. The other point I wanted to mention is there are success stories in government, by the way. Not all is doom and gloom. If you go to the Uganda Cancer Institute, there are some success, islands of success. If you go to the Heart Institute, there are islands of success. But why?
What success is that, Cancer Institute?
There's actually benefit in terms of access to, for example, diagnostic services, access to medicines. They frequently run out now, and that needs to be sorted. But in the Heart Institute, similar, and that can be improved. You know,
we agree.
If we look at Women's Hospital it's supposed to be a success. There might be management issues, but government has established a specialized unit. I think Mulago should go in to that direction. If we are talking about reform, health financing is one way. What he's talking about is human capital. We cannot continue with the same public service method of pre-independence. In this day and era, we are not giving people contracts. You are permanent and pensionable. Key performance indicators are not measured. We are producing, for Christ's sake, 500 young, energetic doctors. If through the spirit of patriotism, patriotism should not be Chankwazi only for the Gimoshos. Get these civil servants.
You can go.
no, I think the deliberate effort to get the young doctors, give them this mission that, by the way, when you go to Karamoja, we shall give you these points. Give them a career path. You will come back and study. We'll pay for you a scholarship. Okay? Then we will pay you so much. You get what I mean? Then your family will benefit from so much, the national service and so on. That kind of scheme has been shown to improve the attraction and retention of doctors in the rural areas. In Australia in the 1930s, not today, in the 1930s when they had rural areas which we needed doctors. Even today in Texas, the rural areas don't have doctors. They use such scheme to attract them. And I think the reform of how we hire, okay, and use services of specialists. Let me give you an example. There's a specialist who had finished. We did a grand specialist camp in West Nile, led by our past president, Dr. Idro. NMS, very good, gave us drugs, I think worth 100 million. There's a woman who was operated by a specialist. The kid was operated by a specialist. She went on the streets of Arua city and was screaming. I've never seen such a miracle. Simply because we are taking around 50 to 70 specialists, ENT, ear, nose and throat, orthopedic, the bone surgeons, and so on, general surgeons, to do those operations, including, club feet, repair them. This specialist, he comes from this region, but he said, Obuku, I think I can go and work in Arua. So, of course, we contacted the PS, as you said, the leadership of the Ministry of Health actually has got the priorities right from the minister and the technocrats. PS, as enthusiastic as she was, fresh, she said, we shall support this program. We deployed these specialists so that with the time they would be absorbed. By the time they were absorbed, this guy, it takes so long that this guy, I met him on the street in Kampala, he even wanted to dodge me. I said, but why are you not in Arua? You promised you're going to. I said, by the time the letter came, he was earning 15 million from moving from, facility to facility in Kampala. And Kenya was calling him for about 25 million, an orthopedic surgeon. But an orthopedic surgeon does not need to go to Arua and stay there. You get? A cardiologist may not need to go. You can tell him, okay, you're in Kampala, but give us 3 days a week. And you contract him. Rather than saying, come and sit here in Arua, it won't work in this day and era. So we can populate the slots and say there are 3 shifts of cardiology in Arua, orthopedic surgery in Lira,
There's no hard-to-reach area. There's no far place. If you pay them well and give them the facilities they need, they'll go anywhere in any corner of Uganda and stay there and work.
But India is the farthest. It's where we go.
Can I say something? But can I say something? Even in the psychology of motivation, money is necessary but not sufficient. Human beings will leave Karamoja because of, for example, schools for their children. Isn't it? They say, there is no school fit for my children here. Peer pressure, Kimosho's children, they studied with some doctors, but Kimosho is taking it to Aga Khan. Why am I? You get what I mean? That kind of thing. So money alone is necessary, but not sufficient. There are doctors whose salaries were tripled in this strike and increase, but their behavior has not changed. You get what I mean? So the Ministry of Health, the Human Resource Department or division, must think harder. Working with the public service, the old ways are not going to work today. We need permanent and pensionable. You can take over from there.
Yes, Patrick and viewers, we need, and this one I think we are embarking on it, and we shall give our recommendations as Parliament, as a Committee of Health. We need to support Ministry of Health, the leadership. I am telling you, Patrick, you interact with these ministers and the PS, you see them really frustrated. Their hands are tied. They actually know what to do. They have the ideas. Their spirit is high, but we are locked in very rigid methods of work. Public service, you don't touch here, you don't touch here. I mean, and certainly I think they reach a point and resign. And these are some of the inefficiencies that we come here and start discussing. But I can tell you, discussing with the leaders at the ministry and even the technical guys in the middle, they have all on their fingertips, but they are constrained by some circumstances.
So, Dr. Obuku, okay, if we even look into the private facilities that we have, hospitals, even if a corporate Ugandan, God forbid, if you fell sick today and you are admitted for just a week in any of these hospitals, majority of Ugandans will not afford. If you afforded, you would sell your land. I wonder why are the medical bills so exorbitant in this town? Actually, people didn't know that hospital bills were too expensive until COVID came.
Yeah.
COVID just exposed what has been the case all the time.
Kamara, what you have described is a classical case of what we call catastrophic health expenditure. That which can make you sell your land, your house, and by the time, for example, unfortunately, you die, you have impoverished the whole clan. One
That's the case.
important individual. And what are we saying? Health, especially medical care financing. Let me not even say health care, because health care can include sexual and reproductive health, you know, distributing condoms and contraceptives and so on, or health promotion. But let's say medical care financing is a complicated problem, even in the richest country, such as the USA. That's why the Obamacare, okay, the Obamacare bill, you know,
Became an issue.
It became an issue. He came in and said, I intend to put the bottom poor, the blacks, the Hispanics, into a scheme where they can be secured. And then the white Anglo, yeah, the white Anglo-Saxon comes and says, this is President Trump, you know, he says, no, we shall remove it. See what I mean? It's a hot issue. Where are the success stories? There are success stories in simple places. In Rwanda here, in Singapore. You know, we are always saying that we're like Singapore. We want to be like Singapore. Singapore fought corruption. Singapore is the #1 country in the corruption perception index. Why am I saying #1? Although in the 2021 report it's #4, there are 3 countries which are #1. These are European, Northern European, Caucasian countries. Denmark, Norway, etc. They are #1, they are tying. Then #2, which is actually #4, is Singapore. Singapore is like us. You know, they came from all this backwardness. Okay, let's not go there. Seychelles is #1 in Africa. It's #23. What have they done well? Namibia, Botswana, what have they done well? They have established systems of integrity. Uganda, we are #20, in the bottom 30 poorest countries. We need to work even double hard to fight corruption in whichever way, so that we get to that level where the Ugandan shilling actually stretches itself. Is there enough money to go around and provide free health care for everybody? Certainly not. But we are hoping the Sudirs of this world will pay proportionally. If he's a billionaire, maybe we'll say 20% goes to health. And then those who are in my village in Loro City, there in northern Uganda, okay, who have nothing, government will pay for them. So government just needs to maintain its funding, but provide a mechanism where Kamara can keep putting money every month in a fund, like the NSSF. It's a success story, by the way. NIRA, this national ID system, is a success story. It is now linked to, you know, telephones. It is now linked to the banks.
Passport.
It is now linked to the passport.
Driving
That
license.
can go to Mulago. That can go to the health system, so that if Kamara comes, and it has worked for URA, you have your TIN. You click TIN, all your details come, the vehicles you have bought, all the, you know what I mean? That can happen in Mulago to improve the record system. So when you come, we know Kamara has come, this is his history, okay? And actually is eligible to be paying. Right now, the Gimoshos of this world, the political class, state house, the judiciary, the elite,
So
all government, let them finish.
You're categorizing me under what? State house?
Wait. The politician, the decision makers, all the statutory authorities and enterprises, all have insurance schemes of some sort, or prepayment schemes on taxpayers' money. And then they will come and tell you, you know, the money is not enough to go around. That is what I call intellectual or ideological corruption, starting from up there. where for us, we can take part of the cake, pay for ourselves. Moreover, in the private insurance schemes, and they are telling you, we can't have a national one. So I think this disconnect, the ideological disorientation there, the new breed in the NRM, like Wakilagima, should help us transform that, so that we see you as actually implementing patriotism. One of the 4 principles there, I understand, is patriotism. So can you bring on the table the issue of national health insurance scheme and persuade the president that we should start yesterday?
Because you have a health insurance scheme of your own.
I want to agree with him, even when he has tried to politicize it. But as health committee, I think, and this parliament, we have been emphasizing the issue of health insurance scheme. And we believe it can help sort out the problem of the common person. And it can bring about some level of equity. While I am very hopeful, and I have some faith in the health insurance scheme, I still have issues with streamlining the clogged system, the silos in our healthcare system. You see, I think, like he put it right, where healthcare system has worked is where there is a cleaned up system in terms of corruption,
Records.
in terms of records, in terms of automations, in terms of how really people are able to access the scheme. So, and I am very optimistic. Maybe by close of our parliament, we may have, the president maybe will have agreed with us to assent to this. And it will go a long way. But in the meantime, Kamara and fellow Ugandans, and this is the appeal that we shall put to all members of parliament, because at least I belong to the Committee of Health and the other committee. I think we need to reform the rules of the game in health sector, of course in other sectors, but health sector being critical as it is, we need to reform to have room for flexibility in terms of management, to hire and fire. Actually, I'm one person who believes we needed to have maybe a hospital authority of some sort, where you're given key result areas, you are assessed, you are praised every quarter or annual or whatever according to the board.
People should be put on contract.
On contracts.
That are renewable,
and if you do
depending
not,
on how you have performed.
Yes, and if you do not meet the appraisal percentages as set by the board, you are terminated. I can tell you, my brother here, I used, of course, we were together in it because I was in Mulago. I later joined the NMS. That's when he was also in the movement with his doctors. He used to emphasize one side. Now I'm very impressed he's bringing both sides. I can see that time he was very conflicted, and I hope that wasn't a form of corruption. That time he would talk about one side, doctors, doctors, doctors. But now at least he accepts that there is also a weak side on the professional practices that people do, the shortfalls,
okay,
the corruption that happens, the absenteeism that happens, the other shortfalls. So if we streamline that, streamline the doctor's welfare, and put up a flexible system that allows innovation and proper management at the level of Ministry of Health, I think we can help improve the health sector.
Gentlemen, I'm going to open the lines so that you at home, wherever you are, you can tell us what you think, your experience, or maybe the solution to the challenges that we face as a country in the health sector. What do you think? The numbers are going to be on the screen right now. You pick your phone and tell us who you are, your name, and keep it brief and concise so that we get to know, perhaps you have an idea or two on how we can move forward. As you do that, Dr. Buko, I understand at one point, President Obote, I think somebody attempted his life, and then he was actually rushed. He was shot at. He was rushed to Mulago, and they worked on him from there. That was a bad incident. But you know, a whole president being treated in Mulago, and it is ending there. Yet an MP today, I don't want them to fall sick, but in case they do, God forbid, somebody gets on a plane and they fly out.
Our speaker was in Mulago. That should be also on record for a whole week. Recently, it's less than a month. Our speaker, Right Honorable Jacob Oranya, was in Mulago for a whole week, and he was managed. And we have had issues. I highlighted the issue of COVID and how many ministers were in Mulago, and they were discharged. I think let's give it to them.
No, COVID made us realize that health security is probably more important than the guns and the bullets, because for a long time we were not health secure. We realized we needed oxygen, but this oxygen wasn't only for COVID. People were dying from severe malaria, severe pneumonia. They needed oxygen, severe anemia. Those three killed 10,000 in the last annual health sector performance report in a year. COVID killed 3,000. But COVID could not permit the decision makers to go out and spend our tax dollars, okay, for their own benefit. I have met an individual, and by the way, that Dr. Bote situation was a very good gesture from the highest level, and that is what we call political commitment. If His Excellency the President and his family, whom he loves so much, or if Kimosho took his children to UPE, if the President came and attended Mulago, trust me, even those who are stealing drugs, you know that man, he also comes here. Those who are not cleaning. If Kimosho, for instance, in his constituency, took his children there, okay? Those funds which are meant to ensure the facilities are okay there, okay? They say, you know, the MP is coming on Friday to check on this education. Those funds would actually be better utilized. And I believe that gesture is very important. Let me give you an example. The president, I think, of Kazakhstan was campaigning in a rural area. The wife experienced labor pains. And just in
just hold, let me, yeah, hold on that point. Let me bring in some Ugandans online so that maybe we get to know what their issues are. Perhaps they have an idea on how we can move forward. I have a call online. Hello. Hello. I have a call online. Hello.
Hello.
Yes, what's your name, sir, and where are you calling from?
This is Joseph Ocho. I'm calling from Nakawa.
Joseph Ocho, you are on air and you are loud and clear.
Thank you. I want to thank the Honorable and Doctor for discussing in details what is affecting our health sector.
All right.
I happen to have a patient right now in a Tutu hospital, but when I called, actually there's no single doctor in the hospital.
Which hospital is that?
Tutu Hospital.
In Teso?
In Teso.
Okay.
And this is so sad to see a person just die, just like that. There's only one nurse or two at night in the entire hospital. It is disappointing. So I want to agree with their suggestions of doing these reforms, really. And I love what the Honorable is actually putting across. He is putting the reforms first. Let us look at cleaning the entire system, the record system, and so on and so on, before even do any other thing. And I don't know, for sure, it is only God. I don't know. Corruption. I don't know how we shall deal with this big animal. Thank you, Kamara.
Thank you
so much.
Thank you so much. Well, that's why we wanted to hear some people have their own experiences. Yeah. Somebody saying
and that's why I told you the problem
patient. Let me also hear maybe two or more callers, and we get back. I have a call online. Hello.
Hello.
Yes, sir. What's your name and where are you calling from?
This is Julius calling from Kisasi.
Julius from Kisasi, you're on air and you're loud and clear.
Thank you very much. I think, thank for the gentlemen who have extensively discussed the issue. Mm-hmm. I think doctor and the politician, the politician is trying to work, but I think the government general has tried to improve on health, but the issue of corruption should also not be blamed on the government, but society. If corrupt people come from our society, so the it should not be blamed on the government alone. Thank you.
I agree. It takes two to tango. There is somebody who's taking the money, and there's somebody who's giving.
Receiving.
So we are equally guilty, the one who's giving and the one who's receiving. Let me also get another call online. I have a call online. Hello. Hello.
Hello.
Yes, sir. What's your name and where are you calling from?
My name is Matthias Mangena. I'm calling from here.
Matthias, you are on air and you're loud and clear.
Thank you. First of all, it's a very good engagement.
You're welcome.
My take is, you know, we cannot have one shoe fitting it all to improve healthcare system. But I must also say that to improve healthcare indicators, also need to carefully invest in education indicators. Because what is causing us more trouble in the healthcare, I'm a health worker myself, what's causing us more trouble, more burden, are the poor outcomes in the education system. And that burdens the healthcare greatly. For instance, the poor child and maternal healthcare indicators are highly attributable to poor education deliverables. The other thing that I want also to say is that we also need to have issues of governance. And governance really stems from the real top. How committed are we as leaders in this country to really stand by or deliver on what we really try to pronounce?
Okay.
And that's one gap that I see that some countries that have been successful, just like Rwanda here. You see committed leadership, but here there's a lot of laxity, and and that is the real benchmark of corruption that we are talking about. Thank you very much.
Thank you. But sometimes people use the Rwandan example, but I've heard also the Rwandan people also have their own issues with their healthcare system. In fact, as recent as yesterday, and so it may not be as rosy as you think.
But even the U.S., I mean, it's so expensive.
Yeah, but
so there are always issues.
I've seen them coming to buy medicine here and take it in Rwanda. I have an example. I've seen somebody.
But what I'm trying to say is
they are also suffering. Probably even have a, there are things you can talk about and try to say it's good. You only have to be across the fence and see whether it's actually the grass is green or not.
So every health system has its own challenges. If you go to the National Health Service, the pride of the UK or Canada, and it's also replicated in Australia, they have that taxpayer-funded system, okay? But the lines are too long. I took a colleague when I was in Canada to attend to a primary health care physician. Very difficult to see. Actually, Canadians would cross over to, especially in Toronto there, they would cross, it's near the US border, cross over to Buffalo, New York.
Let me take the very last caller, and then you'll be able to respond to them at once. I have a caller. Hello? Looks like we have lost the contact, the line that is getting us a caller there. All right. Gentlemen, this is what we're going to do. Unfortunately, I'm not going to take any more of your callers. Maybe those that we had are enough. So, Dr. Obuku, your parting shot as also respond to maybe, they didn't have a specific question to you, but they are also adding to what you're saying.
The last guy talked about social determinants of health. The guy calling from, I think, Busia, okay? And, education, very important. During the lockdown, we realized our education system was not resilient, and that increased certain risks like teenage pregnancies and so on. Food security, even when the government tried to distribute, you could see government had the good intention, but it was probably not sufficient. And then, of course, incomes. Incomes must be part. But in as far as reforms are concerned, I think the game changers are going to be two.
Okay.
One, how we finance the health sector. A national health insurance scheme is inevitable. We can have also some mix, this public-private partnership mix. We can have private health insurance for the NTVs and the corporate world. We shouldn't stop that, but we should think about the common person. Two, we must reform how we attract and retain the human capital. Not only doctors, but when we say doctors, we mean the rest of them. Nurses, midwives, pharmacists, and so on. And the opportunity given to us is this Public Health Act, I think. We should look at it carefully and try to incorporate some of these things, but then bring back the aspect of health insurance.
All right. Thank you so much. Honorable Kimosho, your parting shot.
Thank you very much, Kamara and my colleague. Once again, for me, I want to think that we need to do reforms. You know how these MDAs have been able to perform averagely well? It's because they have adopted the corporate governance principles and culture. You have a board, you have management, you have your targets, KPIs set, there is appraisal quarterly or annually or monthly. They can hire and fire, they can reward. But Kamara, as long as we are still tied in the rigged methods of work, what we put in is what Satan will get out. But most importantly and finally, we must jointly as a country and as a people fight things that bog us down. Corruption, and the corruption that manifests in many ways. Absenteeism, stealing of government medicines, the under-table payments. I can tell you, if government can make a sample in one hospital and correct the under-table payments, Kamara, you will be shocked with that, how much Ugandans spend. So if we make the reforms and at the same time try to streamline the moral question, then at some point we can be given as examples to be performing well. Like I can hear my colleagues talk of some of these countries. I don't know. I have not experienced their, especially our neighbors that I hear being praised. I don't know. You see, there is a difference of being able to, you are able to cover up your problems. And another one, his problems are put forward as and when they happen. So I don't know whether that is a difference or where there are real efficiencies. That is a different matter altogether.
Honorable Dan Kimosho, Dr. Ekwaro Obuku, and you, the viewer, I want to thank you so much for your time and, gentlemen, for your insights. I think we Ugandans deserve better. We are good people and we're a good country. And I think if we do what is required of us, we shall get better. I'm very optimistic about this. Good night, and God bless Uganda.